This is the Lions Club's International Children's Vision Screening Program. With us is past International Director, Dr. Ed Cordes.
Hi, everyone. Thank you very much for tuning in to this PowerPoint. I'm very proud to be able to present to you the new Lions KidSight USA program. What is KidSight? Well, KidSight is a Lions program that is forming a coalition of Lions clubs, districts, and multiple districts that are doing broad-based children's vision screening throughout the country. And then we're using that coalition to reach out to new areas in the United States that are either not doing a lot of screening, but doing some, or not doing screening at all, so that we can expand the number of children that we reach every year. And children's vision screening is really designed to detect risk factors for amblyopia, to find those kids who need glasses, and any other vision problems that are detectable at early ages. About 14% of the children screened every year are referred. And vision problems after age 7 are much harder to treat, so our goal is to concentrate on children between 6 months and 6 years. Vision screening programs actually started in several states way back in the late 90s with the MTI photo screening camera. You may remember in the old days we used these little cameras that put out little Polaroid pictures of the eyes of a child. They had to be interpreted by a doctor to find out whether the child passed or failed. And major programs started in several states. Because they needed eye doctors to interpret the pictures, the early screening programs developed around major universities and other large clinical programs. The university partners provided the interpretive services for the photographs and also data collection and repository. Those programs were given LCIF Core 4 status, and in the late 90s resulted in, as you can see, over $2 million in grant funding to several states who established priority screening programs throughout their areas. And as a result, upwards of 500,000 kids each year under the age of 7 were screened. Today, the university partners are not needed as much as they were because the modern machines that we use for screening give instantaneous results of pass or fail. But the university partners still are very useful to us in providing credibility and providing data management services for us. Lions KidSight USA actually formed this past year. Some of you may remember receiving a request to fill out a Lions survey that asked you several questions, 2 of which were very important. Do you think that the Lions in the United States could benefit from a premier service project that could be developed into a United States Lions identity? And if you answered yes to that question, what project do you think would be the most effective to create that identity? Overwhelmingly, 90% of the respondents favored the formation of a national Lions identity, and overwhelmingly you all said that children's vision screening should be the keystone of that project. So a national planning committee was established in the spring of 2014. I'm very fortunate to have been appointed by then Vice President Joe Preston to establish the committee. My vice chair is Dr. Hauser Weiler, ophthalmologist from Virginia. And we put together a coalition that we call a founders committee of some of the states doing large vision screening programs already, so that we could call upon their best practices and leverage that into expanding vision screening around the country. And you can see the states listed on the slide here. We had our first formative meeting August 16th, 2014, where we set the stage to develop the KidSight program and also establish the rollout, which took place in Puerto Rico at the USA Lions Canada Leadership Forum in Puerto Rico in September 2014. LCIF was very nice under the leadership of past international president and chairman of the board of trustees of LCIF, Wayne Madden, to provide a $10,000 seed grant to help us get started. We've used that money to have two meetings in Oak Brook to develop the KidSight concept and develop a framework from which to operate, and also develop our website, develop other PR materials, and develop the program that we are going to be following over the next several years. The name Lions KidSight USA was approved at that meeting, and that frankly came about from the very many programs throughout the United States that Lions were already involved in that used the name KidSight. We talked to most of them and got permission to adopt KidSight, Lions KidSight USA as our official title. We developed the logo, and we are now developing the capacity to screen all kids under the age of 7 by 2018, and that's about 2.5 million children in total. We are very pleased to report that two of the major equipment manufacturers who make vision screening devices became our corporate partners. Plus Optics USA developed the Plus Optics machine that does vision screening, and Welsh Allen Spot developed the Spot machine that does vision screening. Each of those companies has agreed to donate over a 3 to 5 year period $50,000 each. We're very proud of that. That's $100,000 in non-Lions money that we can use to develop this program throughout the United States. We still may need to have LCIF support us in some areas, but knowing the support we have from our corporate sponsors being there, we really plan on keeping that LCIF grant applications to a minimum. The primary goal of Lions KidSight USA is to detect amblyopia, or the lay term for amblyopia is lazy eye, and the risk factors for amblyopia and lazy eye in children under the age of 6. Of course, as we do these screenings, we will find other things. We'll find children who don't have amblyopia that need glasses, and we'll find other abnormal vision conditions that need to be referred and treated by doctors. But the primary goal is amblyopia, lazy eye, and its risk factors. We do want to concentrate on ages 6 or younger, because after age 6, the chances of successful treatment of amblyopia and lazy eye are greatly diminished. We all know that there are many other things that poor vision in children affect besides just not being able to see a certain letter on a chart at a certain distance away. Children who can't see, can't read. It's a well-established fact in both the vision care and educational communities that 80% of a child's learning comes through their vision. So if children don't have good vision, they're not going to learn. As a result of not having good vision, children don't incorporate into their social structure particularly well. So they have behavior disorders both at school and at home. If they can't see distance objects, they're not very good at participating in sports, so they don't do that. And so producing good vision screening techniques that can identify these children early on can really have lasting effects throughout their life. Some of the history of screening methods, and I know some of you who are watching this PowerPoint will remember that the old days of screening, we just relied on little wall charts with letters or the little E's that point different ways, asking a child what the smallest line is that they could see from a certain distance with each eye individually. And that was good in its day, but then machines started coming out over the years that did more and more comprehensive testing. Early on, when I graduated in 1977, one of, quote, the instruments to have was the Titmus binocular vision screener that tested both eyes simultaneously and also tried to test how well the two eyes teamed together. That was followed by what I said before, the MTI photo screener that had the Polaroid film that came out and required doctors to interpret the results. After that, the autorefractors came out where you could shine a light into a child's eye with an instrument, and the instrument would read the light bouncing back and give us an estimate of refractive error of one eye, and then you would do the test on the other eye and give you an estimate of refractive error or need for glasses. All of those machines have now been superseded by what we would call the modern binocular automated screeners. They're automated because you push one button and align the machine, it automatically takes pictures and takes binocular readings, in other words, simultaneous readings from each eye, and is able to compare the results, telling us whether there are risk factors because one eye is significantly different than the other. The most popular versions of those machines you can see listed on the slide, the iScreen, Plus Optics, and Welsh Allen Spot. And we're very proud, again, that both Plus Optics and Welsh Allen Spot have donated significant financial resources as well as professional expertise and organizational advice as our corporate sponsors.